Hi folks, Christian Brindle here, President and founder of Christian Brindle Insurance Services, author of 2 Medicare books, and host of the most popular Medicare podcast on the internet today, the Everything Medicare Podcast. Today I wanted to talk with you very quickly about the 3 things that you need to look for in order to make a good selection when picking a Medicare Advantage plan. These things will not only help you make a good selection, they will prevent you from ever picking a bad plan and avoid all the horrors you ever hear about Medicare Advantage. Anytime you've ever heard a story from a family member, a neighbor, someone you went to church with about a Medicare Advantage plan, they are completely due to the fact that the person picking the plan or the person advising the person to pick the plan did not follow these 3 steps to picking a good Medicare Advantage plan. Medicare Advantage plans are not perfect. They have their good and their bad to them, and we'll do a future video about that in due time. But if they're selected properly, they can work rather well for the individual. So let's get started. When you're picking a Medicare Advantage plan, it's very, very common that this first area right here is not paid attention to by the person picking the plan. Whether you're talking to, I'm going to come over here so you can see me a little better. Whether you're talking to an insurance salesman or whether you're just dialing a 1-800 number that you saw on the television screen for a no premium, $0 premium plan, I'd say probably 9 out of 10 people that have a terrible experience with Medicare Advantage plans is because of this first thing right here, and that is networks. Most Medicare Advantage plans around the country have networks of hospitals and doctors, and they require you to either stay in network to get coverage at all, or if you go out of network and they allow you to go out of network, they tremendously cut how much they pay, and your bill ends up being much higher than you originally anticipated. So you want to make sure that any doctors that you see, primary care doctors, specialists, any doctor that you've seen at any point in time is going to be covered in the network of the plan you're selecting. Next, you want to make sure that the hospitals of your choice are in the network. Hospital systems, typically in most areas and most markets, all the hospitals in the areas most likely are part of a system of different hospitals. There's multiple hospitals throughout the area that all participate in one group and one company, and they all contract together. You want to make sure that this hospital system that you prefer to go to is all covered in that network of the plan that you're looking at. My personal opinion is you will always want to pick a plan that has a bigger network opposed to a smaller network if you can help it, because you never know when you're going to need to go to some hospital that you may have never been before due to some specialty that they are very well known for. Next, clinics. This would involve clinics, Instacares that you like to go to, durable medical equipment providers. Really, folks, any person that bills your insurance, you want to make sure that they are in the network of the plan that you're picking. Let's move on. Number 2, plan benefits. What do I mean by this? This is very simple. Medicare Advantage plans are structured to combine, not all Medicare Advantage plans, but most Medicare Advantage plans are structured to combine medical benefits, medical coverage included with prescription coverage, and a lot of Medicare Advantage plans come with ancillary benefits, such as dental, vision, hearing, gym memberships, you name it, and transportation benefits, over-the-counter item benefits, etc., etc. But the main thing you want to look for is, if you can help it, you want to avoid having a higher maximum out of pocket. You want to make sure that you're not picking a plan that has a tremendously high max out of pocket. The max out of pocket for a Medicare Advantage plan is the most that your co-pays and co-insurances for medical expenses, meaning doctor's office appointments, hospital bills, surgeries, durable medical equipment, blood work, x-rays, anything that you can definitively classify as a medical expense that comes out of your pocket. It doesn't include what they pay as well as what you pay. It's primarily out of your pocket, goes towards your max out of pocket. If you ever hit that in the year, the insurance company will then pay 100% of your medical bills for the rest of the year, and you want to make sure you're not in danger of ending up having to spend too much before you reach that safety blanket. Keep in mind, max out of pockets reset every single year. Also, you want to make sure that the copays are friendly to what you're going to be using it for most likely. If you go to a specialist once a week, you probably would rather have a specialist copay in your plan that's lower than another plan. You want to make sure that the specialist copay in your plan is as low as possible to keep your expenses down. These are things you want to look at. Some plans might have higher specialist copays, but lower primary care physician copays. That's fine if you go to a primary care physician, but what if you hardly ever do? What if you go to a specialist? You got to keep these things in mind, and you got to look for these things. Extra perks. You got to understand that if something is important to you, such as dental, vision, and hearing coverage, Medicare plans are limited to put it lightly. So it's very important that you make sure your plan does have some of these benefits, and most markets have at least one or two plans that has some kind of coverage. It might be limited, it might not be. It depends on where you live and where you're watching this from. But make sure you're getting all the perks possible with your plan, such as gym membership, silver sneakers, silver and fit, things like that. Transportation benefits if you need it. Make sure you're taking advantage of your plan to the highest degree. Third and final thing that you should really be looking for, I'm going to switch places and come over here now, is RX coverage. Like I said earlier, Medicare Advantage plans combine your medical coverage, your prescription coverage, and any extra perks all together into one plan. It'd be most like any type of insurance that you've had throughout your life. It's not like a Medicare supplement to where it's completely separate from your drug plan, dental, vision, hearing plan, and you have to pick up separate plans for each aspect of what you need. It's all together in one plan. So, prescription coverage. You want to make sure that your medications are covered in that plan's formulary. Every single Medicare Advantage plan has a different formulary that determines if they're going to cover a medication or not. And every single company has certain medications they cover and certain ones they don't. Make sure you don't sign up for a plan that is missing some key and vital prescriptions that you take in their formulary. Make sure that they're covered. Secondly, you want to make sure that they're covered well. Just because they're covered well, just because they're covered in the plan's formulary does not mean that they're going to be covered well. It's very, very important, folks, that you make sure you're getting the lowest copay possible for that prescription. And the only way to do that is to have someone run a comparison for you. If you'd like to know about that, drop down in the comment section some questions and I'd be happy to answer that for you. Last but not least, folks, you want to make sure there's no hoops to jump through on the prescription side. What do I mean by that? What do I mean by hoops to jump through? Well, it's very common for Medicare prescription drug plans of all kinds, whether it be through a Medicare Advantage plan or a separate prescription Part D plan, that they might have a prior authorization for certain prescriptions, meaning that they require documentation from a doctor before they'll fill that for you. Or maybe they have a quantity limit that stands in the way, meaning that you might have a higher dosage that you take than normal that needs to be waived also by your physician. There's things like that that you need to keep an eye out for. The biggest one, in my opinion, is something known as step therapy, which means that the provider would need to show evidence to the insurance company that you have tried cheaper alternative medications in the past and that they haven't worked. If they can't provide that evidence, they have the right to not cover that prescription. It's their way of trying to force you into getting a cheaper, maybe less effective prescription that has similar effects than what you're accustomed to. Make sure that your plan does not have any step therapy exclusions involved. I hope you found this helpful, folks. If you did, and you'd like more Medicare content and information, my name is Christian Brindle. I am on a mission to change the way that people view Medicare and the Medicare industry. I want to make this stuff simple and easy for you. I believe that you deserve to be empowered and to know the information necessary to make a proper decision. If you enjoyed this video, please do us a favor. Drop below a like and a comment, and also subscribe for future content and future videos. Thank you for spending some time with me. Have a wonderful day.